Pelvic congestive syndrome or pelvic congestion syndrome. It's the better said to explain it, varicose veins in the pelvis. So the same varicose veins that we see in the legs, but affecting the veins that we have in the pelvis, in the pelvic floor. Okay. To understand it better, all veins under the level of the heart contain valves because we need to overcome the gravity to make the blood reach to the heart. Okay. So in all the veins under the level of the heart, we have valves. When these valves fail to do their function, fail to close to prevent the blood from falling down, that's called failure or venous insufficiency. In the legs, it's called varicose veins. In the pelvis, it's called pelvic congestive syndrome. In men, it shows like the varicocele in the men, so varicose veins in the genital area. In ladies, it might show like varicose veins in the genital area, vulvar varices, or even without showing itself on the surface. So having varicose veins seen, it can show itself through the symptoms and even through varicose veins on the legs because it can give varicose veins in the legs. The idea, 1 of 5 ladies and 1 of 30 men with varicose veins in the legs, they have pelvic congestive syndrome. They have pelvic component of their illness. Okay, so it's not a rare thing. It's really common thing. It's genetic. It's not really related to pregnancy to say that pregnancy is causing that, because again, men could have it, and I can tell that men don't get pregnant. Okay, so so once men have it, it's a genetic thing. Ladies are more at risk to have it because with pregnancy things get worse only, but it's not a causative thing. Again, 1 of 5 ladies, 1 of 30 men can have varicose veins on the legs, but originating from the pelvis. The symptoms, speaking about the symptoms, mainly the symptoms could be related to pelvic congestive syndrome, but the same symptoms could be an illness by themselves. So in pelvic congestive syndrome, I have irritable bowel syndrome, which again, I could have irritable bowel syndrome like an illness per se, but I could have it as a symptom of pelvic congestive syndrome. Irritable bladder. So when the patient goes to urinate, for example, they have like a soreness, they feel the need to rush to the toilet. Again, all these could happen as an illness per se, but could happen in the context of pelvic congestive syndrome. Lower abdominal pain, heavy periods in ladies could appear. Pain in ladies, and I'm sorry for that, but pain during the sexual relationship, and it's a pathological disabling pain. Some ladies are even, a lot of our patients were referred to psychiatrists because they were told that they have a psychiatrist problem, but in fact, they really felt that pain and could not live their lives with their husbands because they really have a problem, okay, and needed to be treated. So all these hemorrhoids, for example, people could have hemorrhoids by an illness per se, but could have it in the context of pelvic congestive syndrome. So the idea, when I have a patient with hemorrhoids, when I have a patient with all these, I really need to examine the illness itself. Is it just hemorrhoids? But if there is any other things, any other symptoms, then we really need to look at that pelvic floor, do a Doppler ultrasound scan to see the veins. If I have varicose veins on the legs, but these varicose veins are coming from the upper thigh in the genital area and the inner thigh going in the genital area, that's a high risk of pelvic congestive syndrome, a high sign that there is a pelvic component that needs to be seen and needs to be treated. We have many ladies that never even thought that they have pelvic problems because they just simply got used to these symptoms, and once they came for their legs, once we scanned the legs, we just said, okay, there's a pelvic component, there is a pelvic relation with these veins. Did the pelvic scan, the internal scan for the ladies, and it was discovered once they were treated. It was like magic. I could never believe that I can live a better life without pain. She just simply got used to the pain in the lower abdomen, the heaviness in the lower abdomen, inflammation in the genital area, pain during intercourse, the low abdominal pain, irritable bowel syndrome. All these, she thought it's a normal thing, but no, it's not normal. It is not normal. And again, the diagnostic for that, if we really suspect that, we don't need to do a surgery. How unfortunately some ladies they had an open or a laparoscopic surgery just to see what's going on in their pelvis. What the idea? Simple ultrasound scan, intravaginal scan. I'm sorry for the term, but it is an internal scan. With that scan, we see the pelvic veins, we see the functionality of the pelvic veins, and based on that, we can say, yes, it is a pelvic congestive syndrome, or no, it is not. Patients do not need to go for costly diagnostics, methods like MRI, like CT scans. No need to do that. And to be honest, CT and MRI will never tell you, do you have it or not? Because CT and MRI will tell you, yes, there is a vein there, and it is a big vein or a small vein. But again, size does not matter in veins. What's mattering is the functionality of that vein. Do the valves in these veins work properly or not? If they're working properly, then no, it's not. They could be even the biggest vein in the world. No, it's not. Or if the valve is not working properly, even in the smallest vein, it is a pelvic congestive syndrome, and with the symptoms existing, then needs to be treated. Chronic condition or go away? Well, go away by itself, it will not go away. As in varicose veins or any venous condition, it is a mechanical problem of the veins. So the symptoms are related for the blood flowing in the wrong direction, hitting the tissues in the legs, and when we speak about varicose veins, or the pelvic floor when we speak about pelvic congestive syndrome. So the blood is flowing and hitting the pelvic floor with all the organs and all the organs that we have in the pelvic floor, the genital organs, we have the bladder, we have the bowels, we have all. It hits these organs, causing all these symptoms. Okay. So it's a mechanical problem. Taking, I don't know what tablets, I don't know what, applying, I don't know what creams, or doing, I don't know what exercises. All these are simply nonsense, because the vein is simply not working and will not help. So if we have it, the only way to treat it is to get rid of these veins. And when I say get rid, is simply closing these veins, because it's not an open surgery. It's just a simple procedure done under local anesthesia. The way the patient is very much alive, very much awake. If we ask our patients, to be honest, to do something before their procedures in legs or in pelvis, we ask them to learn some jokes, because otherwise, yeah, they have to tell jokes. Otherwise, we get sleepy. So they have to tell jokes. Okay. So it's a simple thing. After the procedure, immediately, mainly in ladies, we tell them your treatment is go shopping. We want ladies to walk. Once they're walking, the risk of their having a DVT, a heart attack, a stroke drops from 1 to 72 and becomes 1 to 1,000 till 1 to 10,000. So I tell ladies, go shopping. Okay, husbands hate me, that's another thing. But I tell them, go shopping, walk. Once they're walking, they're perfect. By the way, again and again and again, high heels, pregnancy, all these have nothing to do with all that, all the problem. High heels has nothing to do with veins, by the way. Pregnancy is a very, very physiological thing. We humans are made to get pregnant and to have babies. That's our way of having babies, okay? So pregnancy is not an illness. Pregnancy is a very physiological thing. If I have a venous condition, pregnancy will worsen that condition, but it will not give birth to a problem. Okay, so if I have a problem, then pregnancy will get it worse. But if I don't have it, pregnancy will not cause it. So the treatment, as I said, is done under local anesthesia, under X-ray guidance. So from the jugular area, we go with a catheter. Again, very small dot of local anesthesia. It might look horrible, like from the neck, but no, it's a very simple thing. This procedure has been done many years ago for heart conditions when we put stents to open an artery. Well, it's the same thing, but instead of opening a vein, I'm closing the vein. So it's the same technique. It's not something new that patients should just freak out. No, it's just a simple thing that's done like a regular thing, to be honest, in all hospitals. This procedure is done inserting a coil in these veins, that metallic coil, that platinum coil, will cause a local inflammation in these veins to make these veins die. So we cannot, as a difference from the veins in the legs, we cannot introduce a laser, for example, in the veins in the pelvis. Well, in the legs, I have the vein, it's a different anatomy. I can put the intermittent anesthesia around the vein, make the vein alone in a pool of water with anesthetic, and kill the vein safely. Well, in the pelvis, it's a cavity. And beside that little vein, I have other organs, I have other tissues like nerves, like arteries, like bones. And you can believe me, you don't want us to be with a laser beside one of the nerves or the arteries, okay? So we need something to kill that vein and to be confined only to that vein without affecting the other organs beside or other tissues beside. So that's why we introduce that coil in that vein, and that coil will kill the vein. The question, will that coil be removed after? No need to be removed after. Again, it's like stents in the heart. It just remains there. The vein is dead and finished. The subject, again, the patient immediately after the treatment, go for shopping, go do whatever they want in their life. It's just an easy thing. No, it is not, because as I said, 1 of 5 ladies and 1 of 30 men with varicose veins on their legs, they have pelvic problems. Do I have to have varicose veins on my legs to have pelvic congestive syndrome? No, it's not. It's not related, okay? But it's just a sign, just an alarm bell for those who have varicose veins that, look, ladies, 1 of 5 in ladies, 30 men might have this condition, okay? But again, if I have a back pain, if I have pain in the pelvis, and all the symptoms that I previously mentioned, and unfortunately the story that we always hear, that doctors are wondering and they don't know what's causing that, and they start to propose some radical surgeries like hysterectomies, like all these radical surgeries. Again, just have a look, just do an ultrasound scan to the pelvic floor, to the veins, to the pelvic veins, to see, is it a pelvic congestive syndrome or not? Because unfortunately, it's not a rare story that we hear in our practice. Ladies on the list of hysterectomies, ladies who had many surgeries. I had a lady who had 9 surgeries on the abdomen. Just we call it exploratory laparoscopy, just to see what's happening, because they don't know what's happening there. Well, simply just put an ultrasound. You will know what's happening there. Okay. So again, if we have all these symptoms and we don't know, I don't have a gynecological problem to cause my gynecological symptoms. I don't have a back problem to cause my back pain. I don't have, for example, there is no visible cause for the symptoms that I have. It's always worth it to have a look at the veins. Well, as we know, medicine, we can have both conditions. I can have the pelvic congestive syndrome, and I can have the gynecological problems as well. So if I have a gynecological problem, I treat it, but I still have the symptoms as well. Again, have a look, see, is it a pelvic congestive syndrome or not? Is it something that I need to take action on it or not? So no, it's not a rare thing. It's a common thing. Unfortunately, not very much well known, unfortunately, and very much misdiagnosed by a lot of doctors. Well, unfortunately, at home, it's less likely that you can do anything with the symptoms. In the legs, again, it's different anatomy, different areas of the body. Okay, it's the same human body, but we have different anatomies in different areas of our bodies. In the legs, elevating the legs will reduce the symptoms, but in the pelvis, you can't really elevate your pelvis. Okay, so the only way to treat and to finish the symptoms is to treat the cause. Okay, like again in varicose veins, like in pelvic congestive syndrome, treat the cause, all the symptoms will disappear. Treat the cause, everything will disappear. The treatment is very simple. Again, any measurements taken at home with the pelvic congestive syndrome is really less likely to give any relief. You really need to take action. I have problems. I have the symptoms. I can see varicose veins, bulging veins in the upper thigh or in the genital area. then immediately go see the specialist, see is it a thing that we need to treat, because again, as in any illness, sooner is better than later in the treatment.